Welcome to Conestoga Conversations Indigenous Edition. In this special segment today, we're going to be speaking with alumni from Conestoga College. We'll explore her educational journey, what she's learned along the way, and advice she has for students interested in nursing. So we'll be talking with Rachel, and she is a graduate from Conestoga College, and we're just going to get right into it. My name is Roxane Shawana. I'm the Indigenous recruiter at Conestoga College, and I am from Wacomico unceded territory on beautiful Manitoulin Island. And I have with me Rachel. So Rachel, why don't you introduce yourself?
So, bonjour everyone. My name is Rachel Radyk, and I'm an Indigenous nurse and Conestoga alumni. And I am from Georgina Island, and I currently live in Waterloo.
Awesome, thank you. So a couple of things that we'll cover today to get the most of this conversation. And what I want to cover is we're going to talk about Rachel's educational journey, some experience that she has working in the field, some volunteering and other stuff that she's done, especially while she was in school and what she's doing now, and then her community involvement and kind of a community you're going to see throughout the whole course of the conversation. So we're not going to spend time specifically on that. But I think what you'll hear when you're hearing Rachel talk is a little bit about how community has affected her and what the connection to Indigenous services has really helped guide some of her actual post-secondary experience more so, but that's really exciting. So we're just going to get right into it here. And Rachel, let's talk a little bit about your educational journey. Sometimes I think when we are in high school, we think that, this is what I'm going to do. I'm going to get out of school. I'm going to do this. I'm going to do this. And then I'm going to work here. And that is my journey. And as students start to actually go through school, we realize that's not often the case, and that sometimes there's a wide variety why isn't often the case. But what I want to hear is a little bit about your actual experience. I see that you are first you went to university and you took your Bachelor of Arts, and for anybody watching, she did do Bachelor of Arts in Communication at Carleton University. And what I want you to do is just kind of pick it up there and talk a little bit about your education.
Perfect. So I just would like to highlight and kind of echo what you said, because I think it's really important that students, when they're in high school, don't always know where they're going. And that was really my case as well. I had expressed to guidance counselors, because my mom is a nurse and she's really inspiring to me, that I wanted to become a nurse. And I was told essentially that I wasn't smart enough to continue down that pathway. And that's why I decided to do my bachelor in communication, because no one else really supported me in pursuing the sciences. So I went with kind of where I was directed to go. But I eventually, after completing my bachelor, or after finishing my 4 years of at my Bachelor of Communications, I had a few jobs with the government of Canada, and I just felt that it wasn't fulfilling work for me. It wasn't what I was needed to, I didn't feel called to the field. So I spoke with my mom, and how I felt a little frustrated and didn't really know where my direction was going in life. And she just encouraged me to go into the general arts and sciences health option at Conestoga to try and become a nurse, right? The first step to always going anywhere is trying. So that's what I did. I went into the general arts and science program, which is essentially a course where I boosted my sciences and my maths from high school to get into science stream programs. And obviously, I did feel some anxieties when going through this, because I was told when I was in high school that I wasn't smart enough to do them. But, I got early acceptance into the practical nursing program. And from there, truly bloomed, because I was in the field that I felt that I was called to be in. So not only did I I fully flourished and, graduated with honors in the practical nursing program. It was a very challenging but rewarding program. I remember studying lots of late nights, staying at the school with friends, studying, writing on all the whiteboards, all the different medications and things that we needed to do, and stressing about things that seem so simple now, that such as physical assessments and in lab tests, but we made it through. We all did it, right? So, but it was challenging, but it was so rewarding because those are skills that I still use today, and they're so ingrained into me. And I would also like to highlight that doing the practical nursing program first during my journey really was a great fit for me, because I was able to work as a nurse while I was going to university to bridge into the RN program. But also, Conestoga had so many great services for me to really succeed and get to any of my goals. When I was in the general arts and science program and the practical nursing program, I accessed the student tutors and academic supports, especially with those sciences, to really help with those difficult topics. And Indigenous student and cultural services had lots of supports. Unfortunately, because my programs were quite busy, I wasn't really able to access them, but their presence was really reassuring, because it's so central to the whole building, that I always would feel that if I really needed it, there was individuals there who would be able to support me. And I think that it's great that everything is kind of a one-stop shop at Conestoga, so to speak, in terms of student supports. Everything's all in one building. It was so great to have the medical services there too, if I was ever not feeling well, or if I needed a prescription, I could just go to the school and I didn't have to go anywhere else. I was already there. So really a great place for students, and really student-centered, which I think is amazing. And yeah, it was really great. I love Conestoga. I think that it was a great school, and my mom and dad and brother are actually all alumni from there too, just as a side note.
You're a Conestoga family.
Yeah. And I guess as I continued on my journey, so after I'd finished the RPN program, I went into the BSCN program. But as I said before, I think that being able to work as an RPN really worked so well for me, because I had the nursing foundation. I knew the skills, I knew the theories. It wasn't anything new to me. I was building that university component, but I already had the foundations that are so essential to succeed. And that allowed me to be able to balance my time a little bit more into furthering my own nursing career, and building myself up as a nursing leader.
Nice. Great. So now you're working as the Indigenous Patient Navigator at SOHAC, is what we refer to it, but it's the Southwest Ontario Aboriginal Health Access Center. Tell me a little bit about kind of how you ended up in this role. I mean, I know that now you're local, so tell us a little bit about this.
So I guess if I were to say how I ended up in the Indigenous Patient Navigator role, well, I would have to go a few steps back. But how I ended up in the role essentially was I started really lighting my passion for Indigenous health, and wanting to really specialize in that field. Mm-hmm. So I started doing more, gaining more experience, reaching out to my home community, and picking up more student leadership roles to surround myself with more Indigenous nursing students to really find a support network who would be able to uplift me and essentially for me to learn more about Indigenous health and to really immerse myself fully into it. And once I had the opportunity to do so, I just took off running. So, I essentially how it all started was I reached out to the Native Women's Association of Canada and the Resiliency Lodge because they were doing some amazing online webinars with art-based teaching to them. So they have like an art component. And I thought that would be a really great team building exercise for, in just like education for the nursing student community, which is essentially like a nursing student council at my school at Ontario Tech. And it actually turned out to be that they wanted a nurse, so it turned into a job because I'd reached out to them. So it's funny how the world works, but from that Indigenous role with being a healthcare consultant with the Native Women's Association of Canada, I immersed myself in learning about Indigenous advocacy of health, educating Indigenous women on their rights when accessing healthcare, and about forced and coerced sterilization. So I really, and from there, I was able to find that I had a passion for wanting to really help in Indigenous health, but also wanting to change nursing for the future and Indigenous health. But I will get into that later. But essentially, I found the COVID Navigator role with SOHAC one day when I was online, and I just applied. So what I did with the COVID Navigator role was essentially it was myself and one other nurse, and we would be in control of what was called the COVAX, or the COVID hotline, for all of southwestern Ontario for the Indigenous population, to help coordinate their vaccines for COVID or provide health teaching or anything that folks needed. Not everyone who called the line was 100% wanting the vaccine. So being able to support folks in whatever way that they needed. And from that role, the role eventually transitioned into a permanent full-time position as the Indigenous Patient Navigator in the Kitchener-Waterloo region with SOHAC. So right now I am working in the Pine Bush mass vaccination site, creating it into a culturally safe and culturally aware space for the Indigenous population when they're accessing their COVID-19 vaccines, but also giving it as an opportunity to educate any staff. All the staff have been amazing and supportive of doing land acknowledgements, really facilitating that change, and seeing and being the conduit of that change has really been really rewarding, and seeing all the support that I've been able to have. So, but I'd like to highlight too, just with all of the work that I've done, I think that nursing is always seen to just be something that you have to do at the bedside, and it's not. You don't have to be a nurse at the bedside if you don't want to, or if you're in your placement and you don't like that, that's okay. There's so many different roles, and roles are changing all the time. There's nursing influencers online. You could build yourself up to be more of a leadership role or an academic in nursing, or doing clinic experience or health teaching. The list goes on and on. Or you could go into even clinical research. There's huge influences for clinical research. My mom, actually, she runs all of the cardiac clinical research at St. Mary's Hospital, our local hospital. So tons of pathways. Don't ever limit yourself.
I really enjoyed too how you actually went after that role, even though you had actually just started. You had contacted in order to ask a question, and find out some information, and that really started your journey. So I think it's really important to, like, anybody watching this, is that to reach out, make sure you're making those connections, take a little bit of a gamble and a little bit of a chance on yourself, and making sure that you're going out there. um, so now you are working in, sorry, I want to talk a little bit about your volunteer experience, although you kind of wrap that up nicely into your educational and work experience. So we'll not concentrate too much on this unless you have something else you wanted to add to it.
I think the only thing that I would like to add to this is that sometimes students think that as a student, you're not able to facilitate change. And I just like to say that's not the case at all. You can facilitate change within, if you find there's great organizations out there. If you are looking at nursing, the Canadian Nursing Students Association is amazing. I can't thank it enough for all of the connections that I've made within that organization, especially within the Indigenous community on a national basis, connecting with elders, just being able to connect with other Indigenous organizations and other Indigenous people that I've made as really close friends that are on the executive team, that I would have never had the opportunity to do so if I wouldn't have taken that step to go into a leadership role. And also, just to highlight one thing that to put into kind of how I put my change into action. Within the Registered Nurses Association of Ontario, I was a committee coordinator on the nursing students of Ontario, and I saw that there wasn't enough Indigenous representation within the entire organization, and I set out on a plan to change this. And it wasn't easy, but I kept to it anyways because I'm stubborn. So first I started within the Nursing Students of Ontario by advocating for there to be an Indigenous student seat, to always make, but then also writing in the Constitution and advocating that there would be cultural safety training for all students, because it is not the Indigenous students' role to educate others on what is appropriate or not. That is for them to do, and for the Indigenous student to feel safe. So that was a huge component to that I advocated for. And then also I took it a step further and created my own interest group within the RNAO for Indigenous nurses and allies. So because there's such a need for there to be a safe space within such a large nursing organization, but also allowing for the allies to come there as well, because allies are a huge facilitator in supporting reconciliation. We can't push reconciliation further without allies in the support of all nurses. So it really connects the two together and braids that, which I think is really amazing. And if you are a nursing student and you want to join, you can reach out to me.
Thank you. We'll make sure to include some information for Rachel and some contact information. Lastly, Rachel, what kind of advice would you give to any learners, whether that be high school students or mature learners, who are interested in nursing as a profession?
So my number one thing of advice to give, because as you can see, my journey has been over 10 years and I don't have any plan on stopping. I want my master's, I want my PhD. It's to never give up. If someone tells you you can't do something, you just prove them wrong. So that is my first piece of advice. But then in terms of, if you are interested in nursing, what you can do for volunteering, you can volunteer at hospitals. I would probably recommend this not during COVID times, because it's not, but all of the greeters are really well protected. Everything's the cleanest it has ever been within the hospital. So if you are interested in healthcare, there's so many volunteer roles within the hospital that you would be able to take on, which you could use to understand the flow of the hospital, really getting that experience of talking with patients or families, depending what unit or where you are given, which is such a huge piece, that communication piece. So I think that's really beneficial. Also, Indigenous youth leadership organizations. I know that there's quite a few that are for youth and high school students. I don't know them off the top of my head, but if you just Google them, you would be able to find them. But starting that leadership at a super young age is great. I wish I would have started taking on leadership roles when I was younger. Not that I'm super old, but but you know what I mean. So I would say that if you have the time, getting involved is super important. And even if that's, getting into a leadership role within your own school, just getting involved, getting used to those roles, getting used to making plans, writing emails, working together in a team. Nursing is a huge team-based setting. You don't work alone on your patients. So learning how to work with others in a team-based setting for a collective goal is essential. And then you could volunteer also for other healthcare organizations. I know that even the mass vaccination center where I was working or am working, it was accepting volunteers. I think they received an overwhelming amount of support. So I think that they're full now, but other healthcare organizations that are out there, if you're a student who drives, maybe even like Meals on Wheels or anything like that, where you can deliver food to members of the elderly community, would be probably amazing, because they're very isolated, especially right now. So there's tons of options. Get creative with it in terms of volunteering. There's lots of stuff, and it's great. I think that also other organizations like healthcare rehab settings, like Hearty Hearts was a cardiac rehab program, but they took volunteers as well, where you could essentially help elderly people who have cardiac issues through a set of workouts and talk to them and everything like that. So that one was great. And then in terms of courses, if you, other than the core courses that you need, I think that taking on courses that you really build those leadership roles is really important, or where you have the opportunity to do some public speaking. It might sound a little weird, but having that opportunity will build that comfort with you when you're having difficult conversations with your patients or with families, or sometimes when you have to even speak up when there's an issue on the floor and you have to talk with management, or even within your school. Building that foundation to have that advocacy is really important. And then I would say if you can do a co-op position to see if you enjoy the healthcare field, co-op would be great, because getting that hands-on experience is going to determine if you enjoy it. You're going to get so much learning from it. Co-op is great. So
that's great. Thank you so much. And Rachel has volunteered. If you do have, if you want to connect with somebody in the field, and Rachel's not the only person that you can reach out to, there are other people. But if you'd like to reach out, then feel free to connect with me, and I'm going to let you know how to do that in our next little bit. I really appreciated all that great advice. The public speaking is not one I'd ever heard before, but fantastic advice. As soon as you said it, I was like, yes, what a good idea. So if you'd like to learn more about Conestoga's nursing programs or different services that we have at the college, please connect with me. What you can do is you can set up a Zoom conversation using my email account. You can text my cell, or you can shoot me an email, whatever is your preferred method of communication. So until next time, Bamapi.